Assalamu alaikum. I am Professor Dr. Suhail Sarwar, and I'm not sharing anything else other than my own experience on Hess Test. And this is a very long story. Particularly, I want to highlight only 3 slides, only 3 subjects, which made me some problem while interpreting the Hess Test. We are suspecting something else, and Hess Test showed something else. And after digging down the history and after digging down, repeating the tests, we came to the conclusion that the Hess test is all right. The history is something else to the start, but at the end we dig out something which resulted in the same sort of a Hess test which we are reproducing every time. My financial disclosures, I will show you 3 cases only and 3 slides only. I will not take your much time. This is the brief history. A 30 years female, history of diplopia. Visual acuity is 0 in her both eyes, and patient is orthophoric on examination. Simultaneous macular perception, which Dr. Sidra call it normal retinal correspondence, and that is okay. Extraocular movements full in all directions. Where is the problem? Why the patient has been sent for me for his Hess test? There is history of diplopia. Let's go and check what was his Hess test. Can you see any problem in it? There was no problem in it. The Hess test is particularly alright in all directions, and even the fixation is centered in that. Where is the problem? When we did this exam repeatedly, and when we again dig out the history, the problem was that there was a history of diplopia, but this diplopia was intermittent. So when you were performing the examination, there was no diplopia, but he has a history of intermittent diplopia. At that time of the Hess charting, he was not having any diplopia. So this was a case where the Hess test went wrong. Let's go to the next case. Case number 2. A brief history. 60 years male. History of diplopia is there. Visual acuity again 0. Orthophoric simultaneous macular perception is there. Extraocular movements full in all directions. History is the same as from the previous lady, except for the age difference. And what are you suspecting now? Patient, history of diplopia. There must be something in the Hess chart. His Hess chart was like this. Same, no problem. Where is the catch? Again, the catch was in the history. And we dig out and we asked him, you are having diplopia? He said, always. Yes. When are you having diplopia? Particularly while driving or while seeing at distance. I am not having diplopia in near vision. So this is the catch. He was having diplopia only for distance, and while we are doing the Hess test, we are doing it as on 25 inches or at a certain distance. At that distance, he is not having diplopia. So we confirmed it on red and green glasses, and he was having diplopia for the distance. So this is again a situation in which the Hess test went wrong. Third and last case is 30 years male, no history of diplopia. Visual acuity same, 20 prism diopters, alternate exotropia. Alternate mean he has central fixation. Extraocular movements full in all directions. There was no simultaneous macular perception. So what are you expecting in this case, I am expecting that he should be having a normal Hess test but displaced at 20 degrees from each other. But when I did the Hess test, this was his Hess test. Again normal. Where is the problem? This is a very tricky thing. Actually, what happened is that the patient is able to clearly fixate when he is seeing from the right eye and locate the position from the right eye, and we are asking to see a chart release test on from the left side. What he did is, he did something very intelligent. This is the release test, and there is a grid on the white acrylic sheet at the back of that acrylic sheet, and that grid is not visible when there is no retroillumination. When we open the light, this grid is open to us. So with the time using this Hess screen, this least screen over and over time for the last 20 or 15 years, what we have noticed is that it has engraved some lines in front of the that chart, and that was visible to that guy. And what he was trying is that he is locating the grid, and he identified that on that grid which point was pointed, which spot was pointed at there, and he then searched out that point in from the left grid, and then he placed the stick over there. So this was the problem, and that is why his Hess test became absolutely normal. So this was my last slide. Important message for Hess screen testing and honest practice. There are two important persons, which persons you have to pick for Hess test. Number one, there must be history of diplopia. If there is no history of diplopia, you are unable to perform, or there is no need of the Hess test. Second thing is, the patient must be having a simultaneous macular perception or normal retinal correspondence. And for that purpose, what I do is that before starting the procedure, we ask the patient to place his chin on this chin rest, and we show him two dissimilar images, one through the mirror and one in front of the face of the patient, and ask that, what are you seeing? If he is seeing doll and the duck simultaneously, it means he is having simultaneous macular perception. So this is our first test to go for the Hess test. If he fails at this test, we do not proceed for the Hess test. So thank you very much.